All right, I got a great friend of mine, Dr. 𝗵𝗲𝗃𝗏 here, who is a plastic surgeon, and we trained together when I was doing facial plastic surgery training in Philadelphia. I want to ask him his expert opinion regarding new development of Ozempic and semaglutide that people using quite frequently and losing weight. I personally encounter many of my patients, we call it Ozempic phase, since individuals lose quite a bit of weight, and not only they lose it in their body, but also the face and the neck become very lax, so they need some sort of facial rejuvenation and fat grafting to restore the volume loss and also the laxity. So what do you see in terms of body that you deal with in terms of restoring those individuals who lose massive amount of weight, like let's say 100 pounds, 60 pounds, 100 pounds? What do you do?
That's a great point. In my practice, I've seen and cared for a lot of patients who have lost weight on semaglutide. And what we're seeing is there's an overall deflation of the soft tissue. The soft tissue becomes deflated, and when we come to sculpt these bodies, the challenge is not always to remove the fat, but what do you do with the excess skin? That skin, after liposuction alone, does not have the ability to retract and redrape. So in my practice, I'm doing a lot more excisional surgery for patients whom I would most likely do liposuction with some form of skin tightening previously. So excisional surgery is on the rise for those reasons. By excisional surgery, I mean removal of skin. So patients, instead of just having liposuction to the abdomen, they need a tummy tuck.
I see.
Instead of arm liposuction, I have to do an arm lift where I make an incision and remove the excess skin, because that skin will not retract and redrape the way that I want it. I always tell my patients who are on these type of injections to make sure their protein consumption is high. Based on their BMI, there's a formula of how much fat, protein, and carbohydrates they need to consume. They need to exercise, but not just cardio. They need muscle building exercises. Right. The problem is that patients who start semaglutide, the amount of weight that they lose in the first couple of months, the percentage of that weight that comes from muscle loss is excessively high. So you can't just inject and continue your life. You have to protect the muscle that you have. If you do it properly, you don't get the hollowed look. You don't get that wasting of the face. You don't. You keep that volume. So I think it's important to drink a lot of water, do muscle building exercises, and eat a lot of protein.
So for those people who don't know the mechanism of this semaglutide, it is blocking the stomach receptors so they feel full. So there is no appetite. Basically, it kills the appetite. So when you're taking less food in your system, obviously over time you lose weight because you're not eating. So the point that you were mentioning is to having a balance, having some carbs, but mostly protein, but very importantly, having exercise in your regimen, because you also lose some protein. When you don't take protein, you lose muscle.
Right.
So exercise, they have to do it with a supervision. You can't just go and inject semaglutide in some clinic that they don't even routinely check your labs, or they stay on top of your overall well-being. They have to make sure you exercise, you eat properly, so everything is correctly done.
Absolutely, it has to be followed, just like any other medication that you would take.
Yeah.
Yeah. Too often we run into friends that we haven't seen for quite some time, and you look at them and you wonder, where's the other half? And it's so obvious, in my opinion, those who are doing it properly and those who are just injecting and living their life. They just have a unhealthiness to them.
Wasted look
that you can
versus
see.
a fit look.
Right. When it's used properly, it's an amazing medication, and it has a lot of ancillary effects when it comes to less desire for consuming alcohol, less desire for smoking, patients with a little
diabetes.
bit of diabetes for sure, absolutely. I mean, that's one of the primary indication. Also, patients who have some attention deficit disorder, they're claiming that they have better concentration and focus on these medications. So I think the future, we're going to see a lot more indications that get approved with this family of drugs. It's just a matter of time.
Yeah.
But the most important thing is to
Proper
encourage
use.
proper use. Absolutely.